Why choosing my practice for your private eye operation is a really important question, but it's a question that's almost impossible to answer without sounding completely cliched, and that's something that I really don't want to do. Any patient listening to a consultant answering this question would expect the consultant to say that they're fully trained, they're registered with a GMC, they listen carefully to their patients, they treat each one as an individual and deliver the best care possible. And you'd expect any surgeon to do that. Ultimately, it's really important that a surgeon and a patient establish a rapport with each other and that the patient trusts the surgeon to deliver the outcome that the patient's expecting. In terms of my practice, well, one thing that I'd say about my practice now is that it implements a safety protocol that I developed as a trainee doctor, as a registrar, to do with cataract risk stratification and risk scoring. That system was developed by myself in my training days in London and is published and is used by various centres in different countries around the world. And I implement that as part of my practice in order to mitigate risks and improve the safety outcomes. So that's an important part of my practice, which I take a lot of pride in. Now, I could spend a lot of other time saying that, I've done lots of clinical research and published outcomes of multifocal toric lens implants, astigmatism rates, the outcomes of toric lens implants. And I could also mention that I take referrals from other consultants in order to, treat complex and cataract patients that my colleagues feel are best taken care of under my practice. And I could also mention that I perform lots of extra tests whenever they're needed. So, for example, patients who've had laser refractive surgery in the past, and that we use state-of-the-art equipment and we deliver the best possible care, because I think that the best reasons for choosing my practice come from the patients that I've treated before. And it's possible for prospective patients to listen to what my previous patients have said on other locations online and on the website. I invite you to contact my practice by calling the phone number provided. We can start the process of consulting and determining your suitability for the interventions that we can provide, and hopefully get you to a point where you're achieving your outcomes and enjoying life without cataract and without needing your glasses and contact lenses.